Welcome back, future nurses. Today, we're diving into one of the most tested concepts on the Nclex, priority questions. Who do you see first? These questions separate good nurses from great critical thinkers, and they can make a major difference in your exam score. In this video, we'll break down 50 high-yield Nclex priority scenarios, each with answer options, correct responses, rationales, and simple strategies to help you think like a nurse. Remember, the Nclex isn't just about what you know, it's about who you would assess first, who's at greatest risk, and who requires immediate action. So get ready to think fast, reason clinically, and build your confidence one question at a time. Question 1. For clients are waiting to be seen. Which client should the nurse assess first? A. Client with COPD and O2 sat 90%. B. Client with new confusion and slurred speech. C. Client with chronic back pain rated 8 out of 10. D. Client with nausea and vomiting. Correct answer, B. Client with new confusion and slurred speech. Rationale, sudden neuro changes suggest stroke, time sensitive. Strategy, ABC plus neuro, acute stroke signs equals highest priority. Question 2. Which client should the nurse see first? A. Post-op day 2 with temp 99.5 degrees Fahrenheit. B. Pneumonia patient with RR32 and restlessness. C. Asthma client requesting an inhaler. D. Client with UTI and burning while urinating. Correct answer, B. Rationale, RR plus restlessness equals early hypoxia. Strategy, airway plus respiratory distress pain mild fever. Question 3. Who should be assessed first? A. Client post-thyroidectomy with hoarse voice. B. Client with leg cast and 5/10 pain. C. Client with nausea after chemotherapy. D. Client with diarrhea for 2 days. Correct answer, A. Rationale, hoarseness may indicate laryngeal nerve damage or airway swelling. Strategy, post-thyroid surgery equals think airway. Question 4. Who is the priority for the nurse? A. COPD patient with clubbing of fingers. B. Client with DKA and glucose 420 mg per deciliter. C. Client with chest pain radiating to left arm. D. Client with chronic anemia and fatigue. Correct answer, C. Rationale, chest pain plus radiation equals potential MI treat immediately. Strategy, cardiac ischemia equals immediate attention. Question 5. Which client is most critical to assess first? A. New post-op hip replacement with BP 8850. B. Client awaiting discharge teaching. C. Client with stage 4 pressure ulcer. D. Diabetic patient with neuropathy. Correct answer, A. Rationale, hypotension in post-op equals bleeding or shock. Strategy, unstable vitals equals priority. Question 6. Who does the nurse see first? A. Heart failure patient with 3+ pitting edema. B. Client with pink frothy sputum and crackles. C. Client with weight gain of 2 pounds in 24 hours. D. HTN patient with headache. Correct answer, B. Rationale, pink frothy sputum equals pulmonary edema respiratory failure risk. Strategy, RESP compromise before worsening HF symptoms. Question 7. Which client is priority? A. Client with RUQ pain after fatty meal. B. Client with appendicitis and rigid abdomen. C. Client with IBS and bloating. D. Client with GERD and heartburn. Correct answer, B. Rationale, rigid abdomen equals perforation/peritonitis risk. Strategy, sudden abdominal rigidity equals emergency. Question 8. Who should be assessed first? A. Post-stroke patient with difficulty swallowing. B. Diabetic patient due for insulin. C. Client with migraine needing darkroom. D. Patient with Crohn's reporting diarrhea. Correct answer, A. Rationale, dysphagia aspiration risk. Strategy, airway protection comfort/pain control. Question 9. Which client is the nurse's priority? A. Burn patient with crackles and productive cough. B. Burn patient with pain 10/10. C. Burn patient with shallow partial thickness wounds. D. Burn patient requesting another blanket. Correct answer, A. Rationale: crackles equals fluid overload/airway compromise. Strategy: inhalation injury and respiratory signs first. Question 10. Who does the nurse evaluate first? A. Trach patient with thick yellow secretions. B. Trach patient with no breath sounds. C. Trach patient requiring suction every 2 hours. D. Trach patient with SpO2 94% on room air. Correct answer, B. Rationale: absence of breath sounds equals obstruction emergency. Strategy: ABC, airway obstruction kills fastest. Question 11. A postoperative cholecystectomy client reports increasing abdominal distension and severe pain. Which finding requires immediate assessment? A. Yellowish bruising around incision. B. Hypoactive bowel sounds. C. Rigid, board-like abdomen. D. Pain with movement. Correct answer, C. Rigid, board-like abdomen. Rationale: rigid abdomen indicates possible internal bleeding or peritonitis, a surgical emergency. Strategy: post-op plus abdominal rigidity equals assess first for hemorrhage/perforation. Question 12. A client with seizure disorder becomes cyanotic during a tonic-clonic seizure. What action should the nurse prioritize? A. Restrain arms to prevent injury. B. Insert tongue blade. C. Turn client to the side. D. Assess family history. Correct answer, C. Turn client to the side. Rationale: side lying maintains airway and prevents aspiration during seizure. Strategy: ABC first, airway protection is priority during seizures. Question 13. A client on heparin therapy develops new petechiae. Which is the first action? A. Administer pain medication. B. Stop the heparin infusion. C. Encourage increased fluids. D. Reassess in 1 hour. Correct answer, B. Stop the heparin infusion. Rationale: petechiae suggests bleeding risk or hit, medication must be held immediately. Strategy: signs of bleeding hold anticoagulant, notify provider. Question 14. A child with suspected epiglottitis is drooling, anxious and sitting in tripod position. Which action is priority? A. Obtain throat culture. B. Start 4 fluids. C. Prepare for intubation. D. Administer cough syrup. Correct answer, C. Prepare for intubation. Rationale: epiglottitis risk of sudden airway obstruction, secure airway ASAP. Strategy: never use tongue depressor. Airway first. Question 15. A patient in sickle cell crisis reports chest pain and dyspnea. Which complication should the nurse suspect first? A. Dehydration. B. Acute chest syndrome. C. Joint necrosis. D. Fatigue. Correct answer, B. Acute chest syndrome. Rationale: chest pain plus hypoxia equals life-threatening vaso-occlusion of lungs. Strategy: sickle cell plus respiratory symptoms equals emergency. Question 16. A client with suspected sepsis has BP 78/40, HR 132 and cool clammy skin. What is the priority intervention? A. Give acetaminophen. B. Increase oral fluids. C. Begin rapid 4 fluids. D. Encourage rest. Correct answer, C. Begin rapid 4 fluids. Rationale: hypotension plus tachycardia equals septic shock, immediate fluid resuscitation required. Strategy: shock equals fluids first, stabilize BP. Question 17. A newborn is grunting with nasal flaring and chest retractions. Which action comes first? A. Delay feeding. B. Apply oxygen. C. Check bilirubin. D. Perform heel stick labs. Correct answer, B. Apply oxygen. Rationale: these are signs of respiratory distress, oxygen to maintain airway. Strategy: ABC, respiratory distress equals first. Question 18. A trauma patient has absent breath sounds on the right side after a chest injury. What should the nurse do first? A. Elevate head of bed. B. Prepare needle decompression. C. Offer pain relief. D. Obtain chest X-ray. Correct answer, B. Prepare needle decompression. Rationale, unilateral absent sounds equals tension pneumothorax immediate decompression. Strategy, life-threatening airway/ventilation problem equals treat now. Question 19. A client with DVT suddenly develops shortness of breath and chest pain. Priority action? A. Apply warm compress. B. Encourage ambulation. C. Administer oxygen. D. Recheck vitals in 10 minutes. Correct answer, C. Administer oxygen. Rationale, sudden dyspnea likely indicates pulmonary embolism, oxygen first. Strategy, DVT plus SOB equals PE treat urgently. Question 20. A client with a pacemaker has a heart rate of 32 BPM. What is priority? A. Monitor for another hour. B. Increase oral fluids. C. Notify provider immediately. D. Offer reassurance. Correct answer, C. Notify provider immediately. Rationale, HR less than 40 equals unstable bradycardia possible pacemaker failure. Strategy, critically low HR equals urgent intervention. Question 21. A child following tonsillectomy is swallowing frequently. The nurse should suspect A. Nausea. B. Pain. C. Hemorrhage. D. Anxiety. Correct answer, C. Hemorrhage. Rationale, frequent swallowing indicates bleeding at surgical site, emergency. Strategy, post-tonsillectomy bleed is priority. Question 22. A client with pancreatitis has Gray-Turner sign. Which condition is suspected first? A. Electrolyte imbalance. B. Internal hemorrhage. C. Steatorrhea. D. Dehydration. Correct answer, B. Internal hemorrhage. Rationale, Gray-Turner equals flank bruising retroperitoneal bleeding. Strategy, bruising plus pancreatitis equals assess for bleed. Question 23. A client with hyperthyroidism presents with fever, tremors, and HR 150. Which complication is suspected first? A. Thyroid storm. B. Myxedema coma. C. Hypoglycemia. D. Dehydration. Correct answer, A. Thyroid storm. Rationale, fever plus tachycardia plus agitation equals thyroid storm life-threatening. Strategy, hypermetabolic plus severe vitals equals emergency. Question 24. A dialysis client has crackles, dyspnea, and increasing weight. What action is priority? A. Administer diuretics. B. Check fistula site. C. Place in high Fowlers. D. Encourage fluid intake. Correct answer, C. Place in high Fowlers. Rationale, crackles plus dyspnea suggest fluid overload, positioning improves breathing. Strategy, airway and breathing before medication. Question 25. An infant has projectile vomiting and an olive-shaped mass in the RUQ. Which condition is suspected? A. Hirschsprung disease. B. Pyloric stenosis. C. Intussusception. D. GERD. Correct answer, B. Pyloric stenosis. Rationale, classic signs projectile vomiting, palpable mass. Strategy, risk for dehydration equals early intervention. Question 26. A head injury client has one fixed, dilated pupil. What does this indicate? A. Concussion. B. ICP increase and brain herniation. C. Migraine aura. D. Stroke recovery. Correct answer, B. ICP increase and brain herniation. Rationale, unilateral dilation equals late sign of increased ICP. Strategy, neurochanges equals immediate assessment. Question 27. A postoperative bowel surgery client has rigid abdomen plus absent bowel sounds. What is priority? A. Ambulate the patient. B. Insert NG tube. C. Reassess in 2 hours. D. Offer clear liquids. Correct answer, B. Insert NG tube. Rationale, signs of obstruction/peritonitis NG decompression needed. Strategy, rigid abdomen in post-op equals emergency. Question 28. A client post-AAA repair reports sudden severe back pain. Which action is first? A. Give analgesics. B. Assess BP. C. Reposition for comfort. D. Monitor pulse ox. Correct answer, B. Assess BP. Rationale, sudden back pain equals aneurysm rupture. Check hemodynamic stability. Strategy, assess vital signs to detect rupture quickly. Question 29. Pregnant patient at 34 weeks with RUQ pain, high BP, and proteinuria. What is priority action? A. Offer fluids. B. Monitor urine output. C. Initiate seizure precautions. D. Provide reassurance. Correct answer, C. Initiate seizure precautions. Rationale, symptoms indicate severe preeclampsia risk for eclampsia seizures. Strategy, protect airway and safety. Question 30. In an asthma attack, wheezing suddenly stops. Which interpretation is correct? A. Condition improving. B. Silent chest, respiratory failure. C. Bronchodilator effective. D. Client asleep. Correct answer, B. Silent chest, respiratory failure. Rationale, stopped wheezing equals no airflow equals life-threatening. Strategy, worst sign of asthma equals no sound. Question 31. A post-MI patient develops a new S3 heart sound. What is suspected? A. Fluid overload/heart failure. B. Dehydration. C. Hypokalemia. D. Pleural effusion. Correct answer, A. Fluid overload/heart failure. Rationale, S3 equals early sign of HF priority assessment needed. Strategy, new abnormal sound equals urgent. Question 32. A kidney transplant client has fever, oliguria, and tenderness over graft site. First concern? A. Kidney stones. B. Transplant rejection. C. Dehydration. D. Dietary noncompliance. Correct answer, B. Transplant rejection. Rationale, fever plus decreased output equals rejection signs. Strategy, immediate evaluation to preserve graft. Question 33. A client with potassium 6.2 milliequivalent/L shows peaked T waves on ECG. Which is priority? A. Administer insulin plus glucose. B. Give potassium supplement. C. Encourage high potassium diet. D. Place client on bed rest. Correct answer, A. Administer insulin plus glucose. Rationale, insulin shifts K+ into cells quickly, prevents fatal dysrhythmias. Strategy, hyperkalemia kills the heart, treat fast. Question 34. Elderly UTI client becomes confused and restless. What action first? A. Provide quiet environment. B. Assess vital signs. C. Encourage fluids. D. Administer sedative. Correct answer, B. Assess vital signs. Rationale, acute confusion may indicate sepsis, vitals determine urgency. Strategy, new confusion equals infection/oxygenation issue. Question 35. Post-stroke client has decreasing LOC. What action is priority? A. Perform neurochecks Q4H. B. Place in high Fowlers. C. Notify provider immediately. D. Provide water with meals. Correct answer, C. Notify provider immediately. Rationale, lower LOC equals worsening ICP, emergency intervention needed. Strategy, neurodecline equals act fast. Question 36. Client on TPN has blood glucose 48 mg per deciliter. What is priority? A. Stop TPN. B. Give 4 dextrose. C. Check next glucose in 1 hour. D. Call dietitian. Correct answer, B. Give 4 dextrose. Rationale: severe hypoglycemia threatens brain function, treat immediately. Strategy: low sugar now. Question 37. Chest trauma patient shows tracheal deviation to the left. What is priority? A. Reassess in 15 minutes. B. Prepare for needle decompression. C. Apply warm compress. D. Encourage slow breathing. Correct answer: B. Prepare for needle decompression. Rationale: tracheal shift equals tension pneumothorax, fatal without immediate action. Strategy: life-threatening airway shift equals emergency. Question 38. Neutropenic client has temp 100.4 degrees Fahrenheit 38 degrees Celsius. What is priority? A. Administer antipyretic. B. Notify provider. C. Offer oral fluids. D. Recheck temperature in 1 hour. Correct answer: B. Notify provider. Rationale: small fever in neutropenia equals life-threatening infection. Strategy: immunosuppressed plus fever equals treat ASAP. Question 39. GI bleed patient has HR 130, BP 86/48, cool clammy skin. What is the first intervention? A. Apply warm blankets. B. Start 4 fluids. C. Administer antacids. D. Give oral fluids. Correct answer: B. Start 4 fluids. Rationale: tachycardia plus hypotension equals hypovolemic shock, fluids first. Strategy: shock equals 4 fluids priority. Question 40. Post-mastectomy client has bright red drainage saturating the dressing. Priority? A. Mark drainage. B. Notify surgeon. C. Change dressing. D. Administer analgesic. Correct answer: B. Notify surgeon. Rationale: bright red drainage equals active bleeding. Strategy: hemorrhage report immediately. Question 41. ARDS patients require FiO2 100% to keep O2 sat 89%. Priority action? A. Increase activity. B. Prepare for intubation. C. Reduce oxygen flow. D. Reassess in 1 hour. Correct answer: B. Prepare for intubation. Rationale: needing max oxygen indicates respiratory failure. Strategy: high O2 needs equals impending intubation. Question 42. Client in Addisonian crisis BP 70/40, weak and confused. Which intervention first? A. Give corticosteroids. B. Increase oral fluids. C. Provide emotional support. D. Give stool softener. Correct answer: A. Give corticosteroids. Rationale: crisis equals severe cortisol deficiency, rapid steroid replacement needed. Strategy: Addison equals low and slow steroids save life. Question 43. Spinal injury client develops new paralysis below the level of injury. First action? A. Give pain medication. B. Call rapid response. C. Reposition patient. D. Encourage rest. Correct answer: B. Call rapid response. Rationale: sudden neuro change equals cord compression, irreversible without fast action. Strategy: acute neuro decline equals immediate emergency. Question 44. An infant with pertussis turns blue and stops coughing. Priority intervention? A. Encourage coughing. B. Begin rescue breathing. C. Obtain sputum culture. D. Notify parents. Correct answer: B. Begin rescue breathing. Rationale: cyanosis equals loss of airway support, breathing immediately. Strategy: airway first in infants. Question 45. Clients with DVT report hemoptysis and chest pain. What should the nurse do first? A. Elevate affected leg. B. Perform Holman's sign. C. Apply oxygen. D. Ambulate client. Correct answer: C. Apply oxygen. Rationale: chest pain plus hemoptysis equals PE, oxygen first. Strategy: suspected PE equals rapid oxygenation. Question 46. Burn victim has singed nasal hairs and hoarse voice. Which condition is priority? A. Fluid deficit. B. Airway obstruction. C. Hypothermia. D. Infection. Correct answer, B. Airway obstruction. Rationale: inhalation injury can rapidly block airway, secure airway first. Strategy: burns of face/airway always first priority. Question 47. Clients in hypovolemic shock have urine output 10 milliliters per hour. What is priority? A. Administer 4 fluids. B. Encourage water intake. C. Give diuretics. D. Monitor weight. Correct answer, A. Administer 4 fluids. Rationale: very low urine output equals poor perfusion, fluids restore volume. Strategy: low output equals kidneys failing, fluids quickly. Question 48. Pregnant woman 30 weeks gestation has vaginal bleeding and abdominal pain. Which is priority to assess? A. Fetal heart rate. B. Blood glucose. C. Amniotic fluid color. D. Fundal height. Correct answer, A. Fetal heart rate. Rationale: suspected placental abruption, fetal oxygenation must be checked first. Strategy: bleeding plus pregnancy equals assess baby ASAP. Question 49. Client with Guillain-Barré syndrome has shallow respirations 8 per minute. What action first? A. Administer analgesia. B. Prepare for intubation. C. Reposition frequently. D. Provide passive ROM. Correct answer, B. Prepare for intubation. Rationale: respiratory muscle paralysis equals impending respiratory failure. Strategy: GBS watch respiratory system closely. Question 50. Ventilator high pressure alarm sounds and there is no chest rise. First action? A. Check for tube obstruction. B. Decrease tidal volume. C. Silence the alarm. D. Call respiratory therapy. Correct answer, A. Check for tube obstruction. Rationale: no chest rise plus high pressure equals blocked tubing or mucus plug. Strategy: vent alarm equals assess tubing plus airway first. Amazing work! You just completed 50 NCLEX priority questions, focused on the most important concept behind critical decision-making: who do you see first? If you found this helpful, make sure to like the video, subscribe, comment more NCLEX questions, if you want another set. Remember, the more you practice, the more automatic your prioritization becomes. When test day comes, you won't just answer. You'll think like a nurse. Thanks for watching, keep studying, keep believing, and I'll see you in the next video. You've got this.